hello everyone. Welcome to another Fullscript webinar. Thank you for attending with us today and Dr. Melina Roberts. My name is Kaylee. I'm with the marketing team here at Fullscript, and we're very excited to have Dr. Melina Roberts here today to talk about how to build a solid foundation of health in our children, including guidelines for introducing nutrition and techniques for repairing digestive terrain in pediatric patients, among other things. Before we get into the presentation, though, just a reminder that this is being recorded. So all registrants, whether they attended today or if you have to drop off early, will get get access to the recording through your email, as well as any extra resources. And we will talk a little bit more about it. But Dr. Roberts has a protocol she will also share with all registrants. So that will be included as well. And you can always find the resources and the recordings on our website at fullscript.com/webinars. And throughout the webinar, if you can see on your GoToWebinar dashboard, there's a question section. Add questions in there as we go, and we will have a little time at the end to answer a little Q&A. So before, again, I totally pass it over to you, Dr. Roberts. I'd like to thank you for being here today. I'll let everyone know a little bit about you. I know you'll go into it, but Dr. Roberts is a naturopathic doctor, a author of Building a Healthy Child, and the founder/medical director of Advanced Naturopathic Medicine Medical Center in Calgary. She is recognized as one of the top biological medicine practitioners in North America and a lecturer at the Paracelsus Academy. She's a leading authority in the field of naturopathic medicine, specializing in biological medicine, effectively treating digestive issues, chronic disease, and cancer. Dr. Roberts is a graduate of the University of Waterloo and the Canadian College of Naturopathic Medicine in Toronto. And she did a 2-year postgraduate study in biological medicine with the Paracelsus Clinic in Switzerland. And I believe that you're also a black belt in karate, a 3rd degree black belt in taekwondo, a former rugby player, which is super, super impressive. So I could keep going, but I will pass it over to you, and I will jump back in for a little live Q&A towards the end.
Awesome. Thank you so much, Kayla. So let's figure out how to get this all working. But I'm excited to talk to you all about, and thank you so much for attending, because I appreciate you being here, taking time out of your busy schedules. I know that we all have super busy schedules, so I appreciate you just being here today. And we're going to talk about a really important topic, which is how to build this solid foundation in health in our children. I think this is really important, that we build healthy children. I think that this is something that we really need to be prioritizing, taking care of our children's health. And just a little bit about me. Kayla did an awesome job of introducing me. So I think that in terms of the bio, she pretty much covered it all. I've been practicing now for 17 years. Time goes by quickly. I just did a TEDx talk in New York City, and I'm hoping that that video will get released soon. It's on this exact topic on how we can build health in our children. And I have a podcast and a YouTube station and all that fun stuff. All right, so that's a little bit about me, but let's talk about my personal journey. And because really, I didn't start off doing pediatrics, and a personal journey is that I was one of those kids who suffered from bad allergies and eczema. And when I was about 13 years old, a family friend said to my parents, you know, you should try taking her to see a naturopathic doctor. And at that point in time, we had no idea what a naturopathic doctor was. We didn't know what they did or if they could help me. So we decided to give it a try. We were open-minded to try something different. And what happened is that within a few months of seeing this doctor and following his plan, all of my allergies cleared up. It was like magic, because we really didn't understand how it all worked. And so that was really my first introduction to naturopathic medicine, and seeing really how the body had that ability to be able to heal itself. I'm going to add another note in here, because then I didn't start off in my practice in terms of treating kids. In my practice, what I started off treating was chronic disease. And the reason I got into chronic disease was that when I was in my second year at the naturopathic college, was my dad was diagnosed with pancreatic cancer. And so I started to do a ton of research into cancer therapies, finding out what was out there. I was amazed by the amount of information that was out there in the scientific literature that really no one was talking about, and it was showing to be really effective. So I really was diving into a ton of the research into cancer therapy. Unfortunately, my dad passed away 9 short months later, but that really started me on the journey of exploring alternative therapies for treating cancer. And when I graduated, I did that 2-year postgraduate in biological medicine, and I was traveling the world to just figure out who was having success in treating cancer. And fast forward a number of years, and I was pregnant, and I was becoming a mother, and I was wanting to make sure, thinking ahead and thinking, okay, how could I make it so that my child didn't have to go through the same health challenges that I went through? And what I realized in treating a lot of chronic disease in my practice was that everything came down to gut health. And that if we worked on improving their gut health, that we could improve really the health of the patients. And so I wondered if it was possible to be able to build my child's gut health properly from the beginning, so that she wouldn't have to suffer through bad allergies and eczema like what I had, as well as her not having to have chronic disease in her future, being able to prevent that chronic disease in her future. So in my practice, I was also coming across many parents who also didn't want to have to deal with food allergies, food sensitivities, digestive disorders, and any kind of childhood illnesses that their children were having. And so what I began doing was I began researching, and I came across three principles that would lead to the foundation of my food introduction program. And that's what I'm going to be presenting to you today. And so what that program allows us to do is to build our children's health from the ground up. So I was able to do that with my daughter, who's now 14 years old, and also do that with my patients over the years. And then through my book, I was able to reach a larger audience with this information. Now, I talked about biological medicine, but what I realized is that a lot of people don't know what biological medicine is. And it does have a crossover with naturopathic medicine in understanding that the body has an innate ability to be able to heal itself. But one of the differences is that in biological medicine, we just extend that a little bit more and say that the body has the ability to heal itself when it's in the proper environment. And that's what we really focus on in biological medicine, is obtaining and being able to establish that proper environment. So we want to get that whole body, every system of the body, to be able to be functioning optimally, properly. And so how we do that is we first have to identify and remove stressors. And I say that I describe it as 6 stressors on the body. So there's food sensitivities, immune challenges, heavy metals, environmental toxins, everything physical and everything emotional. So those are all different stressors on the body. And usually most problems are multi-causal. So there usually won't be just one stressor. There's usually a number of different stressors on the body. And then what we want to do is we want to improve the function of every system, every organ of the body. So that's the essence of biological medicine, and it's based on these two main philosophies. So one is adaptability, and adaptability is how I describe health, that our body needs to be able to effectively adapt to its environment. So if we look at this when we look at this animal here, you can see that you can see that he adapts to his environment here in that first picture. And then you can see in the second picture that he's not adapting to his environment. And when we don't adapt effectively to our environment, then we aren't able to properly self-heal and self-regulate. So adaptability is a huge part of biological medicine. And then the second part is terrain. And so in order for our cells to be healthy, they need a healthy environment to live in. So this is a big part of obtaining health, is being able to clean up the environment. So that's the environment all around our cells, and we call that terrain. And the main part of biological medicine is being able to nurture that terrain and to keep that terrain healthy. So those are some like deciphering factors to how biological medicine is different. Now, another key of biological medicine, I would say of naturopathic medicine too, but we really focus on it in biological medicine, is digestive health. And digestive health is the key to long-term health. So in my practice, I see a lot of complex chronic disease. So I see a lot of difficult cases. And what I've really come to understand is that we always have to go back to healing the digestive tract. And sometimes this can be shocking to patients. You know, they're coming in with some chronic, you know, complex disease that no one else can figure out. And my starting point is always, okay, we need to heal up the digestive tract in order to get your system on track. And, you know, they'll always be like, yeah, but I have cancer, or I have an autoimmune condition, I have allergies. Why are we working on the gut? And understanding that the digestive tract is central to all of health is very important. We literally are what we eat. Our bodies can convert the foods we eat into every cell, tissue, organ in our body. What we eat and how well our body can absorb the nutrients from the foods we eat dictates the health of our body. The better shape our digestive tract is in, the better shape or better health our body is in. So understanding that connection is so important to understanding how we are going to obtain long-term health. Now, there's really 4 important factors of digestive health. One is absorption. So we need a good, healthy digestive tract in order for us to be able to effectively absorb the nutrients from the food we're eating. We need those nutrients in order to supply every cell, every tissue, every system of our body needs those nutrients, and they come in through our digestive tract. So that's one important part of digestive tract. The other part is elimination. So our digestive tract is essentially a tube from one end to the other, so from our mouth to our anus. And with that tube, we take in nutrients and then we get rid of toxins. We take in what we need and we get rid of what we don't need. And so we need to be effectively eliminating those toxins, or else those toxins get reabsorbed into our system. So we need a good digestive tract in order to properly eliminate what our body doesn't need. We need to remove that toxic load. So a large part of that is good bowel movements. And I won't talk too much about bowel movements, but really we should be having 1 to 3 really good quality bowel movements per day. Yeah, I tend to talk a lot about bowel movements, but I'm going to just leave it at that. The other part is that the digestive tract is a barrier. So the same way that our skin is a barrier to the outside world, on the outside of our body. The digestive tract is a barrier to the outside world on the inside of us. Remember, I was talking about how that it's basically a tube, but it's our barrier to the outside world. The only way in is that we have to get through that barrier of the digestive tract. So we have a few different barriers in the digestive tract. We have the microbiome, so that ecosystem of bacteria and fungus that live within our digestive tract. We have some chemical barriers, like we have digestive enzymes, we have mucus, and then we also have the physical barrier, which is the lining of the digestive tract. And the lining of the digestive tract is actually just like one cell deep. And there's these proteins that hold those cells together called tight junctions that line the digestive tract. So it's really important that those barriers are really strong to ensure that what stays outside of the body stays outside the body, and only what we need gets into the body. And often we can have breakdowns in those barriers. We can have breakdowns like inflammation happening in our gut that will break down that microbiome. We have barriers that could break down those tight junctions. So then food that's not completely digested can end up in the bloodstream. And that would be a breakdown of the barrier of the digestive tract. And then just on the other side of that digestive tract, on that mucous membrane, that lining of the digestive tract, is our immune cells. So about 80% of our immune system is actually housed within our digestive tract. So it's really important that we take care of our digestive tract in order for us to have a good, strong immune system. Now, just to kind of go through some statistics is like, why is this even important? But food allergies are on the rise. Food allergies are present day accounting for their 1 in 13 Canadians will suffer from food allergies. Asthma is also the most common emergency room visit in Canada, and that about 12% of Canadian or children have asthma. And then the statistics on chronic disease are also quite high. Chronic disease in children is 1 in 2. So 50% of our children are suffering from chronic disease, and chronic disease is on the rise with our entire population. And we think of those as diabetes, heart disease, cancer, but there's also a number of other chronic diseases too. And the amazing thing is that we have the ability to change these statistics. We have the ability to be able to prevent common digestive disturbances like the colic, bloating, gas, constipation, diarrhea. We could be preventing common childhood health issues like those skin rashes, allergies, eczema, ear rashes, asthma, mood swings, irritability, behavior problems. And we could be preventing chronic disease in adults. And we can do this all by how we feed our children. And this is going to be allowing us to build a solid foundation for long-term health. Now, there's a study called the Pottinger cat studies, and I'm not sure how many people heard about this, but I remember learning about this when I went through school. Oh, actually, I must have learned about it later because it was later, but I must have learned it when I went to a lecture. So, because I'm just looking at the date, and I graduated in 2004. So I was thinking I learned about it in school, but it must have been later. But there was this cat study, and these cats were given a diet that was not ideal for their digestive tract. and they developed all kinds of allergies. And then if this diet was continued for a second generation, then the incidence of allergies increased. And by the third generation, the incidence of allergies was close to 100%. So I was thinking of my childhood allergies and passing on my allergies to my child. And I just became really determined to try to break this cycle. And sometimes people look at those studies and they say, well, those are in cats. What's happening in humans? And when we look at humans, we do see that that we can actually reduce the incidence of allergies in humans by breastfeeding, by doing an early diet of fruits and vegetables and healthy fats, and taking probiotics. So my food introduction program is actually based on 3 principles, which I'm going to go through. One is that we need to build a healthy microbiome. We need to support proper child development by introducing foods in line with organ maturation. And we need to be feeding our children real nutrient-dense foods and avoiding processed chemically latent foods. And really what happened was that when I was looking through at all the different food introduction programs out there, I realized that there was no other programs that followed these principles. So this is one of my favorite topics, which is the developing microbiome. So I could talk a lot about it, but I just want to kind of briefly talk about it, because that microbiome is this ecosystem of microbes. They're colonies of bacteria and fungus that live within our digestive tract. And this microbiome is actually essential for processing nutrients, proper immune function, preventing disease progression. And in order for us to have a good microbiome, it needs to have diversity, and it also needs to have diversity, and it also needs to sorry, I'm just losing my train of thought for a second. So it has to have diversity, so lots of different microbes. And one of the ways we can actually get more of that diversity is through a different number of factors. We need, one of the ways that we first of all get that microbiome is we get that colonization. So we get the colonization first of all through birth. What they found in studies is that the diversity of that microbiome is very different in babies who are vaginal births versus babies who have C-sections. And then there's also a difference in terms of that colonization of bacteria in the gut in relationship to babies who are breastfed versus babies who are formula fed. So this can definitely be affecting the diversity of that gut flora. And what we also need is we need a proper balance of that microbiome. So we need a balance of what we call healthy bacteria and unhealthy bacteria, or that unhealthy bacteria is more just called, it's more, I refer to it as, I'll refer to that diversity as not just unhealthy, but more like an opportunistic bacteria. So it's, if that bacteria has an opportunity to be able to overgrow, then it will. And this can be really helpful in terms of building our body's unique foundation of the microbes. But what I found in my research, which I found really interesting, is that we actually build that foundation of that microbiome, so that microbiome that we will have for the rest of our lives between birth and age 3. So that means that we have a small window of opportunity in order to build a strong foundation in our children. And the other principle I came across is this topic of something called ontogenetics. And ontogenetics is the study of human development from embryo to adulthood. And what happens is that our organs, they begin to develop in utero, so in the womb. And then they reach full maturation at different stages outside the womb. So what we need to be doing is we need to be introducing foods in line with organ maturation, and that's how we can support proper growth and development. Now, part of that is understanding all of these different stages of development of our organs. One is understanding that babies are born with a hyperpermeable digestive tract. So this means that their digestive tracts can absorb materials really easily. But that means that we have to be really careful with what we put into their digestive tract. The other factor is that the blood-brain barrier, so that barrier to the nervous system, is not fully developed until about 12 months of age. Another important factor is that the pancreas doesn't reach full maturation until approximately 2 years of age. So this means that we do not produce the enzymes to break down grains until age 2. So this means that we shouldn't be introducing grains before age 2, because then babies just won't have adequate amounts of the enzymes to break down the grains. Another thing is that the liver doesn't reach full maturation till around 4 or 5 years old. So that means we have to be really careful about the toxic load that we're introducing to our children, especially through their foods, because the liver just doesn't have the capacity to be able to handle higher amounts of toxic load. And another important factor is that the immune system doesn't reach full maturation until age 7. So we are working with an immature immune system before that, age 7. So we need to be really careful, again, what we're introducing to their systems before that age 7. So another important factor, this is the third principle, is that since the beginning of human existence, our bodies have been hardwired to eat real food. So we haven't been hardwired to break down processed, packaged foods that are really just stripped of nutrients, fortified with nutrients, which means that they're not in a really bioavailable form. Our food right now are infiltrated with chemicals, so pesticides, herbicides, insecticides, antibiotics, synthetic hormones, preservatives, food dyes, food additives. And our foods have really been manipulated and changed. They've been genetically modified. We've microwaved our foods, and this makes it challenging for our bodies to be able to break them down and properly metabolize them. So here's the truth, is that we need to be feeding our children foods that their bodies can recognize and turn into useful fuels. Now breastfeeding, what we know is that breastfeeding is the perfect food for an infant. Babies have a really delicate, immature digestive tract, and ideally, the food that we want to be giving them is breast milk. And the benefits of it are beyond just supplying them with a perfect food that's bioavailable, has all the nutrients that they need, but it also is a way to give them their innate immune system. It's supplying them with nutrients, hormones, enzymes, healthy bacteria that they need to grow and develop. So I recommend that there's exclusive breastfeeding for at least 6 months, and then breastfeeding for a year. You can introduce those, and so you're doing breastfeeding and solid foods. And I'm not sure if I have this in my notes, but the thing is that if you look at the World Health Organization, they will show you that on a world scale, people are actually breastfeeding for an average of 4 years. So I know sometimes women are like, oh, like 1 year is a long time to be breastfeeding. And I know sometimes there's circumstances that they're not able to. But in terms of the health of our children, the longer we can breastfeed, the better for our children. They've shown in studies that children who are exposed to cow's milk, and the challenge is that most formulas are made from cow's milk, and really like the soy milk isn't much better, but those that are exposed to cow's milk before 4 months of age have a 50 to 60% increased risk of developing type 1 diabetes, which I think is quite significant. And they've also showed that breastfed children have an 8.3 point higher IQ than children who are formula fed. And they've also shown that breastfed children have a reduced risk of asthma and overall lung function. So this is other benefits, reasons to be choosing breastfeeding. Another important thing to realize is that mom's diet while she's breastfeeding is also very important, because what mom eats will move into the breast milk. So we want to make sure that mom's diet is really healthy. This is probably one of the biggest challenges of treating babies, is that when I see babies in my practice, moms will be like, oh, like I'm breastfeeding, they think they're doing everything right, but baby still ends up maybe with a rash or maybe with some colic. And I'll say, okay, well, we're going to do, these remedies for baby, but what we also need to do is that mom needs to change her diet in order for us to get benefits. So what you have to also realize is that in a breastfed baby, baby could be having some allergic or have some reactions to mom's diet. And this can be a lot of different reactions. And these reactions are just indications that the body is trying to communicate with us. It's trying to eliminate something. So I think that that's also, part of naturopathic medicine, it's part of biological medicine, is understanding that symptoms are just the body's way of communicating with us. So if they are experiencing rashes, wheezing, eczema, colic, spitting up, vomiting, painful gas, constipation, diarrhea, any of these symptoms are just our body's way of trying to eliminate a substance that doesn't agree with their system. So what I recommend in terms of breastfeeding mom is that breastfeeding mom avoids alcoholic beverages, cow's dairy, wheat, corn, refined sugar, and that they limit eggs, pork, soy, and coffee. So just getting into the first foods for our babies. And the first foods you want it to be the foods that can be easily absorbed. And remembering that our infant small intestine is really hyperpermeable. So it means that foods get absorbed really easily. So you want it to be in a really bioavailable form as soon as they're taking them in. And we also have like this limited capacity to properly we don't have as much digestive capacity. So we don't have as much digestive enzymes as an adult does. And in an infant's digestive tract, what happens is that if you're taking in foods and they're not completely digested and broken down, and they also have this immature immune system, then the body can actually be seeing those proteins as potentially harmful. And that can be leading to a number of what we see as common symptoms. So taking that into consideration is really important, and that's what this plan helps us to avoid. So at 6 months, what we're doing is we are, and I'm going to be giving you a nice handout that comes with this webinar that goes through this in a really nice way. But our first foods at 6 months are going to be the hypoallergenic vegetables that are easy to digest. So this is going to be like your broccoli and cauliflower and carrots and peas and sweet potatoes. At 8 months, we can introduce some of the fruits. And so these fruits would be like apples and bananas and berries and peaches and pears. And at 10 months, this is when we can actually introduce proteins. So these will be the proteins like your beef and chicken and lamb and turkey and fish, also your egg yolks. But then we can also be introducing some of the tougher to metabolize vegetables like the cabbage, parsnips, and spinach. And typically at this age, we're still pureeing the foods. And at 12 months, in a lot of cases, women are weaning off of the breast milk, and a great thing to wean onto is goat's milk instead of cow's milk. Goat's milk will still have a lot of the nutrients that their body needs, but it won't have that inflammatory protein called the casein, which is just a large protein in cows that is a bit tougher for our bodies to be able to properly digest. And then we would introduce more acidic fruits and vegetables like the tomatoes, the oranges, the pineapple. 18 months, we can start to introduce some of the more complex carbohydrates. So that'll be your beans, legumes, rice, seeds, shellfish, quinoa. And I guess we're going to continue. Yeah. And then at 24 months, this is the point that the pancreas actually reaches full maturation. So this means that we'd be able to introduce those grains. Because at this stage, the digestive tract is better developed, the microbiome is more established, the immune system is stronger. So we can start introducing more of those hyperallergenic foods. So those are the grains, the cow's dairy, the egg whites, soy, nuts. And then at 3 years, I suggest waiting longer to introduce the hyperallergenic foods because that gives the digestive tract and the immune system more time to develop and mature. And so I recommend introducing peanuts at age 3. I'm already starting to think of some of the questions that will get asked. Because I know that there's another theory out there that you introduce the hyperallergenic foods early. But what I found is that if you build a solid foundation of health within our children early, so you build a healthy microbiome, you give the lining of the digestive tract time to heal and to become strong, and you give the immune system time to become more mature, then what I've seen through my practice is that people who follow this plan, that we see 0 cases of anaphylactic allergies to peanuts when we follow this plan. And I know that when they're introducing them the small amounts early, and I guess that's also in an average population, they get a reduction in the number of peanut allergies. But I would suggest that if someone is a researcher and can do some studies, that if we can, because I know that what I've seen in my practice would be considered anecdotal information. But what I've seen is that, when you follow this plan, that, I haven't had any patients who've developed anaphylactic allergies by following this exact plan. So just kind of touch on those because that's a common question I get when I do this presentation. And in terms of those food introduction tips, what I recommend doing is that we introduce a small amount of a new food, that you introduce it in the morning. So that gives us all day to be able to see a reaction. And then I also suggest waiting 4 days until introducing another food. And during those 4 days, what you're doing is you're watching your child and seeing if you notice any kind of reaction. So any reaction from sneezing, runny nose, rash, redness around the mouth, the anus, the urethra, changes in bowel movements, changes in personality. Those are all signs that the baby may be having a reaction to the specific food. So you need to be paying attention to all of those things before you introduce a new food. One of my recommendations is that for premature babies, that you introduce foods according to their adjusted age and not to their actual age. And then in terms of consuming foods, I recommend that you consume organic, non-GMO foods. And the reason for that is that you're doing that to decrease that toxic load on the liver, because the liver can just be so easily overloaded with toxins, because the capacity for them to be able to handle toxic loads is a lot lower than an adult. And so they just can't handle the higher toxic load in most of the foods. So I do recommend changing over to organic, non-GMO foods. Now, just going to do a couple quick case studies. Is that I had one patient and they followed the plan exactly with their son, and what they found is that he had no allergies, no eczema, no ear infections, never had to be on antibiotics. And overall, and I typically see that with parents who have their kids follow these plans, is that you know, they're not experiencing what everyone would call like all of the typical childhood problems because they're following this plan. Now, no, there's always those other cases, which I understand happens, is that I had a mother who was unable to breastfeed, and I know this can happen for a number of different reasons. So with the first child, what they used was a commercial formula, and so I'm going to say that this is before this mother met me. And the child was spitting up all the time, not sitting up, always just seemed uncomfortable. And the mother had brought the child into me at that 8-month mark. And at that point, we changed the baby over to a homemade formula. And so this is a homemade formula that's based from goat milk. And at that point, the baby stopped spitting up, reached all of their developmental milestones, healthy, happy. We had to do some work in order to make sure we healed up the gut after that damage that was done by the formula, but overall is now a healthy and happy girl. With their second child also unable to breastfeed, but now she knew a bit more. So she started off right away with the second child on a homemade formula. And the second child has no allergies, no eczema, no ear infections, never been on antibiotics. So just a really positive cases that I get to see every day in my practice. So, a question you'll always get is that, what if we didn't do this plan? What if we started it later? And the thing is that it's just easier to be able to build the body up right from the beginning. But if you weren't able to follow this plan, there's still hope. It just takes a lot more work. It's understanding that our body is this dynamic system that's constantly breaking down and building back up. We have new cells that are replacing the old cells constantly in the body. The body's constantly breaking down and then building back up. Just for example, our colon cells are replaced every 4 days. Our skin cells are replaced every 2 to 3 weeks. Our red blood cells, they live for 120 days. Our white blood cells, they live for about a year. So, and we have an entirely new body every 7 years or so, give or take. But it's pretty amazing that our body is constantly building back up. And so what we need to be doing is that we need to be providing the body with the right environment so that it can rebuild to be stronger. And we need to take away blockages that aren't allowing the body to be able to properly heal. And then we need to support the body with all of the right building blocks in order to build our systems up strong. So that means that any child or any adult who didn't follow this plan, there's still an opportunity to be able to build back a healthy microbiome. So I think I made it through on time and even some time to ask some questions. So you can see there's a picture of my book. If you're interested in it, you can pick it up at really any place that you can buy books. And those are all my contact information. There's my website is advancednaturopathic.com, and probably the place where I hang out the most on social media is my Instagram account, and there I'm Dr. Melina Roberts. My YouTube station, I post a lot of videos on my YouTube station, which is growing quickly, which I'm happy to see because I'm put a lot of work into those videos and supplying people with good information. And I want to thank you for attending. I appreciate you being here, and I hope that you found this information valuable. And I'm going to be around to answer some questions. And I also want to thank Fullscript for inviting me to speak. And I appreciate the invite, and I hope that you guys also found this information beneficial.
Yes, great. Thank you. A few questions coming in. That was great. A few comments saying great presentation. Thank you. So really, really interesting and exciting to hear about. I think we had some of the questions are like threefold. So
Okay.
I'll start with the first one I saw. To optimize an infant's microbiome while breastfeeding, are probiotic supplements beneficial for newborns? And then, how early can probiotics safely be introduced to babies, and are there specific species or doses that we should focus on?
Yeah, so yeah, I'm a strong believer in starting with probiotics right away, just because, yeah, you're going to get some probiotics through breast milk from mom. You get some of those beneficial bacteria through a vaginal delivery. So those are different ways that you're getting those healthy microbes. And then the next introduction that you'll get is through the foods that you introduce. But I suggest so that you could start with those probiotics right away. I am typically starting with my patients one by Genestra called HMF Baby B, and that's for breastfed babies. If your baby's formula fed, then they need some different species, which is put together in that HMF Baby F. And so, and I believe with Fullscript, what I've done is I've put together a treatment plan or a protocol, and it includes those probiotics. I'm trying to think if that answered all of those, that multifold question.
Yeah, that's a good reminder too for the protocol will be available shortly, and we'll include that on the page where the recording is, as well as in the follow-up email. So you can have access, as well as all those. We can share again your YouTube channel and any other resources. There was the handout in the control or in the dashboard. I think I reminded attendees that it was there, so we'll make sure to share that as well.
Okay, excellent.
The next question says or asks, what about toddlers who don't have an appetite? When should I be concerned? I've been told to offer all kinds of foods but not force the child to eat. What can I try in that case?
Yeah, so I think for the fussy children, I would say like um like what we're doing is I usually like the options for foods are a healthy food or a healthy food. Like you're never offering them a food that isn't good for them. And you know, like your options are carrot or celery, cauliflower or broccoli. It's just like there's no other options on the table, and that's how I parented. I know maybe that's not going to work with most parents, but it's just that um, I just don't think that you should give in to feeding them foods that aren't going to help in their proper growth and development. Um, I know, yeah, if they're fussier, the truth is that at some point they're going to eat, right? So they're never going to starve. I think that that's what we kind of worry about with our babies and our toddlers, that if they don't eat that food at this specific moment at that specific time that you're offering them, that's going to be a problem. But they are going to eventually, they will eventually eat. And and to me, it's just your options are like they don't have an option of having anything that's unhealthy. I hope that helps. I know that parenting is challenging, and I'm never trying to tell parents what to do, and I'm not trying to judge parents in any ways. But um, I think that yeah, in terms of our leniency, you're still, you know, it's only healthy or healthy.
Yeah, great. And no, I think that's great. Um, the last, or I think the last question, or is again a couple of them. It's interesting because it's about a U.S. registered dietitian nutritionist. So, as a U.S. registered dietitian nutritionist who consults with home daycare providers, homemade formula is not allowed. What is a good alternative to human milk for those mothers who cannot or choose not to provide their own milk? I know you did say you did have a couple options. I think goat's milk maybe might have been one of them, but
Yeah.
an interesting question, I think, from the
Yeah.
US.
So goat's milk would be an option. I'll see if they supply that. There is a formula from Germany that some of my patients will order. I would have to get that link for you. And I wonder if Fullscript would offer have it on their but usually there's one from Germany that's pretty clean. And I will have patients who will order it. It is expensive, but you know, it's your child's life. And just trying to think of other options, like the other the other options I've had other mothers do is the breastfeeding banks. So those are options too. I've had moms who weren't able to breastfeed varying reasons, and they were able to get milk from a breast milk bank, which I think is amazing, right? Because I say it takes a community to be able to raise healthy children, and I greatly admire mothers who are donating their milk to these breast milk banks.
Yeah, I agree with you on that one. I think most of us can agree on that.
Yeah.
Okay, those are, I think, kind of the big main ones that came through. If there's any more, I know in this presentation there was links to Instagram and YouTube and on ways to connect with you, and as well as webinars at fullscript.com. You can connect with us. We can pass them along if we need. If there's anything people think of after the presentation, we can try to get those answered for you as well. This was a great presentation. I know jam-packed with a lot of information and resources, so I'm excited to be able to provide those to our attendees. But thank you, Dr. Melina Roberts, for being here with us today. And we hope that we can do more in the future with you as well.
Sounds great. I would love to. Sounds
Great.
great.
Yeah. And last reminder too, it's being recorded, so you will get it as soon as possible. And all our webinars live on fullscript.com/webinars, so you'll be able to access this recording there as well. But that's it for us today. Thank you again, Dr. Roberts, and we hope that everyone has a great rest of their day.
All right. Thank you so much.